This argument about free healthcare for illegal immigrants. It's unbelievable to me, the shamelessness and the brazen lying that you're getting now from the Democrats. And the person who is most proud about funding free healthcare for illegal immigrants is Gavin Newsom. Hello, everyone. Welcome to the Steve Hilton Show. Packed show today, including everything you need to know about the shutdown that's going on at the national level, the California angle with this lie that they're telling about no money going to fund free healthcare for illegal immigrants. Of course, that's a total shameless, brazen lie from Gavin Newsom and the other Democrats. I'll explain how that all stacks up. And I've got a deeper point, actually, about the shutdown and what it means for how we run the government in this country generally. There's something I want to say about that. Then we have Susan Shelley with some amazing updates on the Los Angeles fires, which you won't want to miss. And then a really important conversation with someone who I've met out there on the campaign trail on the whole question of the vaccine mandates, medical freedom. He's been a real champion, a firefighter who really stood up for common sense and the truth during COVID. It's a great conversation and reminds me how important it is that we don't forget all of that. And that's why I've said when I'm governor, we'll have a COVID accountability commission to make sure that we do not let the people who just push these terrible things and really, whether that's the lockdowns or the vaccine mandates, totally unjustified, destroying so many people's lives. It's a really good conversation that's coming up today as well. So let's start with the shutdown. The government shutdown happening in DC, affecting all of us around the country. And there's three things I want to say about it in increasing orders of impact and depth. The first point is this argument about free healthcare for illegal immigrants. It's unbelievable to me, the shamelessness and the brazen lying that you're getting now from the Democrats. So here's the actual truth of the matter. The proposal from Chuck Schumer and the Senate Democrats that they have sent Mike Johnson in order to get this whole process back on track is specific legislative language that repeals, amongst other things, a particular section of the one big beautiful bill that was passed earlier this year on July the 4th. And it relates to healthcare. And that particular aspect is the part of the one big beautiful bill that cut off federal funding for free healthcare for illegal immigrants. So right there, on its face, it's obvious that they're lying when they say, oh, it never happens. There isn't any free healthcare for illegal immigrants. What are the Republicans talking about? This is ridiculous. It does happen. It did happen. And one big beautiful bill, amongst other things, cut it off. And the proposal from Chuck Schumer would reinstate the status quo before the one big beautiful bill. In other words, allowing Medicaid funds to go to illegal immigrants, which is what was happening beforehand. And then but there's another aspect of that, which is these Democrats now saying, "Oh, we're not in favor of that." It's ridiculous for so many obvious reasons. Number one, do you remember that debate in the presidential primary where they were asked, all the Democrat candidates were asked specifically, it was Savannah Guthrie, you've probably seen the clip, do you support Medicaid funding, healthcare funding going to undocumented people? Every single one put their hand up. Every single Democrat candidate put their hand up proudly. And then talking of proudly, the person who is most proud as a Democrat about funding free healthcare for illegal immigrants is Gavin Newsom, who's bragged about it as an example of his, humanity and principle. And he has been extending it in California. And this is the point that really I want to hit, because this aspect of it, I really do know and understand. And you may have seen a video that I put out on X. It got a lot of attention where I went through the numbers, but I'll do it here with you as well. Here we go. Gavin, over the years in California, Medicaid, which in California is called Medi-Cal, has been extended to illegal immigrants. I think it started in 2015 when Jerry Brown was governor, and bit by bit they've added new qualifying recipients, elderly people, children, and so on. And it was Gavin Newsom who finally, as he said, this is social justice and the principle of free healthcare as a right, etc., extended it to all able-bodied adults in California, including illegal immigrants. And he went on and on about how proud he was of that. In the first year of this, which we're in right now, his estimate for how much this would cost was $3.1 billion that was to be funded entirely by California taxpayers. But here's what happened. The costs were coming in during the year because, of course, they didn't know how many people would take advantage of this because they don't really know how many illegal immigrants there are by definition because they're illegal immigrants, so you don't really know. And so they thought it was going to be 3.1 billion. That's what they said in their own budget proposal. And then during the course of this year, month by month, there were hearings on this in Sacramento. The costs went up and up and up. And so during the course of the year, Gavin Newsom and the Democrats in California had to get extra money to pay for it. Do you know what the final cost of this was? The final estimate for the year? Not 3.1 billion, 9.5 billion, three times as much. So, of course, they don't have the money because we're in a budget deficit. So, what did they do? They went to federal Medicaid and they had two chunks of money, over 4 billion that they got through reimbursement for what they call emergency services, but actually was nothing of the sort. It was to fund this gap for Medicaid. And then the other component was this, what they call the California loophole, which is this total scam called the provider tax, where the California government puts a tax on the providers of healthcare that gets paid to insurers as a wash. And then some of that money comes from Medicaid, is reimbursed from federal funds, 60%. That's another 3.7 billion dollars, something like that. So all of this money, billions and billions of dollars, came from the federal budget to bail out Gavin Newsom's expansion that was 3 times more expensive for free healthcare for illegal immigrants than he first said. And by the way, in response to the outcry over this, and all the people in California and elsewhere saying, hang on a second, this is like ridiculously expensive and we can't afford it and we got a budget deficit. He made a big show earlier in the year of saying, okay, fine, we're going to tighten up eligibility and we're going to rein in this program, right? And it was reported like Gavin Newsom pulls back on free healthcare for illegal immigrants. But guess what? When you look inside the budget, it's gone up from 9.5 billion. Next year, it's going to be 12.1 billion, $12.1 billion in California, just California, for free healthcare for illegal immigrants. That is their estimate, right? That emerged in a hearing of the budget committee in Sacramento from the governor's executive branch, $12.1 billion. And guess what? Now that you've got Republicans in charge of the federal budget, that money's not going to come from the federal government. So who's going to pay for it? You are, if you live in California. California taxpayers are going to fund that. And here's what it's going to cost you: $900 a year just for this, for every household. $900 a year just for free healthcare for illegal immigrants. So this nonsense about Democrats don't believe in free healthcare for illegal, but they're doing it right now in California, and you're going to be paying a lot more for it next year. That's the first point. Second point about the nature of this shutdown, like why are we here? It's very important to understand the process. So for years in Washington, the budget setting process was a complete joke, and you ended up with, instead of what's supposed to happen, which is that the spending of the federal government, which Congress allocates, power of the purse, it's the House of Representatives that starts that process. There's an appropriations committee, which is supposed to oversee the process. And then they divide up the budget into 12 separate areas. This is how it used to be done, like decades ago, where you have the ability, therefore, for the relevant, like the different subject matter areas and the relevant committees, the members of the House and the people who understand, to actually work on their bit of the budget separately. And that's the process that used to exist: 12 separate appropriations bills, so that you could have some prospect of having some reasonable, process around evaluating what should be spent, what should be cut, and so on. But in recent years, that's completely gone out of the window. That process has been completely broken. And so what we ended up with, and we know this term very well, are these omnibus bills, thousands and thousands of pages long, that just get cooked up behind closed doors. It's not the committees doing it. It's just the sort of party leaders. And it's always presented. You've seen it year after year at the last minute, usually at the end of the year, and everyone's trying to leave Washington for Christmas or whatever. And there's this enormous omnibus bill just lands with a thud on their desks, and they're told to vote for it or not, yes or no, without any chance to scrutinize it. Mike Johnson has actually, to his great credit, restored what they call regular order in the appropriations process. And he has been going back to what used to happen, which is you do these bills separately. And they've already done, there's 12 that you're supposed to do. They have done 3 of them by the deadline, because the deadline for the federal government is not the end of the year, it's the end of September. So by the end of September, they're supposed to have done 12. They didn't get 12 done. It's very complicated. They got 3 of them done. And all the other, 9, were working away at their bits of the budget before the deadline. They didn't get it done. So that's why we're in this situation. So Johnson and the Republicans said, look, we're doing really well. For the first time, we've actually got the process working as it should be. We've done 3. They were voted on in the House and passed. We've got another 9 to do. You're all working away. Let's give ourselves another, 7 weeks to finish the process properly. And so that's what they put forward, what they call a clean CR, means continuing resolution, to give them another 7 weeks to finish the process. And there's nothing in the clean continuing resolution other than just keep things going as they are now. There's no politics in it. There's no policy in it. It's just, let's just give ourselves another 7 weeks so we can really do a nice job and scrutinize things properly. And at that point, the Democrats that was passed in the House, and the Senate Democrats, where you need 60 votes in the Senate, the Republicans only have 53. Chuck Schumer said, we are not passing it. We're not going to give you that extra 7 weeks. Why? Because when he did do that earlier in the year, in March, he got massively attacked by his left for caving into Trump. And what he's really worried about, like all these politicians, his own political career. And that means a primary from AOC in New York. And so this is the entire thing is driven by that, by Chuck Schumer worried about being primaried by AOC. So this time around, so we're not voting for this. And then they send in all their demands, which is completely inappropriate because this is not a policy making a part of the process. That part of the process is going on. And if they'd have just given them another 7 weeks, they could have had all those arguments about healthcare in the relevant committee hearings on the different bits of the budget. So it's just totally ridiculous what they're doing. It's entirely politics. All this stuff they're putting out there about their demands on healthcare, it's got nothing to do with it. That's just a sort of fig leaf to cover up the fact that this is an entirely personal political matter for Chuck Schumer. And so it's just really important to understand the process. But the third point I wanted to make, which is actually bigger than all of the others, is the reason that we're in this mess year after year, shutdowns. And, okay, credit to Mike Johnson for at least getting a bit of, order back into the process. But still, the real issue is that the federal government and Congress in particular is trying to do too much. The scale of what they're trying to do, the scale of their spending just makes this an impossible process. And so what we come back to is what I've said for years and years and years. You've seen me talk about it endlessly, which is that the government in America is far too centralized. There's far too much power and control and spending in the hands of the federal government, in the hands of Congress, in the hands of all the different departments. It's ridiculous that this vast country, the world's biggest economy, so many detailed things about healthcare, education, welfare payments, housing, urban development, all these things run out of Washington. And first of all, there's a constitutional point, the 10th Amendment, which is very clear that unless powers are specifically in the Constitution allocated to the federal government, then they should be reserved. This is I'm quoting now, reserved to the states respectively or to the people. In other words, if it's not in the Constitution, the states should have it as a control. None of these things that the federal government is doing is in the Constitution. The things I've listed and many more: housing, urban development, healthcare, welfare, all of these things should be done at the state level. The federal government and Congress should have literally no role, not just a reduced role, no role in healthcare, in housing, urban development, and many, many more. And of course, there are things that make sense to be handled at the federal level. Immigration, obviously, things to do with transportation, where you've got networks that cross the country. You could make a case for some environmental protection issues. The air doesn't stop at state borders. So of course there is a role for some of that, but we've gone way too much in the other direction. And that's what makes it so impossible. When you're trying to run things in this giant centralized system, it's just impossible. I always make the comparison with the EU. The reason that I was in favor of Brexit was that I was there at the heart of the UK government in 10 Downing Street, and I could just see how ridiculous it was for so much power and control to be centralized in Brussels, in the EU. I'm telling you, the federal government in Washington is way worse than anything you get from the EU. The EU didn't try and run schools in England, or the hospital system in England, or the welfare system. I mean, there were certain rules, but they didn't try to run those systems. So, as far as I'm concerned, the real lesson from these endless, ridiculous shutdowns is to stop this centralization of power in America, to honor the 10th Amendment and restore control over these vital things to the states where the control really belongs. All right, Susan Shelley is with us today. We've got some updates that we're both going to share actually on Prop 50. And then Susan has some really interesting information on the Los Angeles fires and various investigations into that. Susan, I want to start with Prop 50. I know you've got something very interesting to tell us about, which I didn't know about. I know we're all focused on this. We're all kind of campaigning in different ways. I just want to start with my update because it's unbelievable, actually. As you know, and I'm sure the audience knows, I've talked about it a lot, my goal has been to stop this thing in the first place. Of course, we know all the reasons it's unconstitutional, outrageous, totally unfair, gerrymandering, cheating, rigging elections, etc., by Gavin Newsom. And we know that the only reason he's doing it is his own personal presidential ambition. So he looks like the guy that's kind of fighting Trump and all the rest of it. And as a result of all of that, I wanted to stop it even happening so that we don't spend $300 million of our money on this thing. And so about a month ago now, I filed a lawsuit in federal court to try and stop this because it's so blatantly unconstitutional. And here's the update on that process. Gavin Newsom and Shirley Weber, the Secretary of State, they were the kind of the complaint was addressed to them as the people who are in charge. They did everything they could to delay it. They said they hadn't been served. It's not true. They went through all these tricks to delay the clock from beginning so that they could push this thing beyond the election. Anyway, we went back and said we need a preliminary injunction. We've got to speed this thing up, and so they finally responded, and then we finally got a court date for this thing. Guess when? November the 7th, after the election. Just like, what? So we're now, that's just heard. So we are going to go for an expedited hearing. That's the next step, and try and hurry this thing along. But it's such an insult to everyone's intelligence. Like, oh yeah, fine. We'll just, we'll hear it after the elections happened. Unbelievable.
Yes, it's very frustrating to try to use the courts to fix these election problems because they're very slow, and it's always the case that they're too late.
Exactly. Anyway, there you are. That's my quick update. Any news on that during the course of the week before next week's episode? Of course, I'll share that on social media. But you have a very interesting perspective on this coming out of Illinois, Susan.
Well, Illinois, the former Speaker of the House in the state of Illinois, is going to prison for conspiracy and wire fraud and bribery and the usual Illinois corruption. And one of the researchers at a place called Illinois Policy wrote that long after he's behind bars and gone, his gerrymandering will go on. And what he did is, his name is Michael Madigan. He's 83 years old now, I think. And on October 13th, I think it is, he is scheduled to go to federal prison, although he's fighting to have that delayed while he appeals the case. But what he did is he created a situation in the state legislature where he was in total control of absolutely everything, what bills could be heard, what bills would never be heard, all this kind of stuff. It enabled him to draw these districts. He created so much power that he was able to control the drawing of the districts for the state legislature, and probably for Congress, where he had all the power over who lived and who died politically. And this is the role model for Gavin Newsom. The idea is that you draw these things to limit the power of your opposition. And that's what Gavin Newsom is trying to do. He's trying to cut Republicans and independents completely out of power in California politics by drawing the districts essentially so all the Republican areas are split up into little shards and attached to bigger districts where everybody's outnumbered by Democrats. That's what this districting is. Now, of course, people can vote however they want to. It doesn't guarantee that they'll vote the way they have been, but it's likely that they'll vote the way they have been. And so he is using Illinois political corruption tactics in California and claiming that he's saving democracy with this.
It's really amazing. By the way, just one example. I was up in the northern part of the state a few weeks ago. Um, the sort of central north and north, well, the whole of the north. And right now, there's a district up there represented by Doug Lam, a congressional district represented by Doug Alpha, who kind of which basically covers that vast area actually, and it's a very big district geographically because there's not that many people live up there compared to the concentrated populations, for example, in the Bay Area or LA or whatever. And so you've got this big, Republican district. So guess what they've done? It's actually unbelievable when you look at it. I mean, and there's so many egregious things about these maps that they've drawn. This one is a joke. I want people to picture, and it's been described as this, the head of an elephant with the trunk. And that's basically what they've drawn. So they've taken this enormous part of basically the northern part of the state of California, reliably Republican, and they've added on this so that's the head of the elephant, this trunk, this sort of sliver that goes all the way down the coast, down to and including Marin County. Marin County, one of the most liberal places in the state, therefore in America, is now sharing representation with the rural conservative North. And of course, the reason they've done that is because they want to add in all those people. So it's gone from something insane, like when you look at the presidential vote, kind of plus 25 Trump, 25% Trump district, to now 15% Harris. It's just incredible. Just the shamelessness of it. It's just so obviously ridiculous.
If you go to the website for the Independent Redistricting Commission, it specifically says they are going to try to keep communities together and connect them to communities of similar interests. Why? Because they want to ensure that your voice is heard on issues like education and taxes. And that's why they take public input for months and months and months to make sure that people's interests are connected to other people with the same interests so that they're well represented, instead of what you're describing, which is putting people who are 400 miles apart in the same district, completely different sets of interests and not well represented.
And it's just, to me, I use this word all the time because it's so apt for what's going, the shamelessness of it. There's no shame. You can almost imagine them in the meeting thinking, what are we going to do? Like finding because basically we had 9 Republican districts before this, which itself was way underrepresentative of the Republican vote in California. So it's already been gerrymandered, because, as I've made this point endlessly, we have roughly 40% of the vote, and very steady in California for Republicans the last 20 years. But 17% of the congressional representation. So it's already way underrepresented, the Republican vote. Now it's going to be 6% with this. But you just imagine them thinking, all right, so we got our 52 districts for Congress, and we got 9 Republicans, and we need to get another 5 because that's how we fight Trump. And so they're thinking, they literally, you can imagine them. They just went through the different 9. So what can we do with that one? And you can just imagine them in the meeting thinking, well, maybe we adjust the borders here and bring in that town and whatever. And then someone says, I know, why don't we go take the entire coast right down to the Bay Area and add that on? And someone's saying, really? That's pretty. Do you think we can get away with that? That's kind of great. Yes, we can get it. We can do anything because that's the mentality, that they think they can get away with anything. And that's the mentality you get in this one party rule. And that's why it's so important that we challenge them properly and beat them next year. But before that, we got to beat Prop 50.
Yes, and everybody's gotten their ballots now. If you're a registered voter in California, you should have gotten your ballot in the mail by now. And you can just vote no and go. You don't have to do much more than that. Because if you want the system that we currently have, which is the Citizens Redistricting Commission, which the voters of California strongly approved in 2008 and 2010, if you want to keep that and you don't want to change it, vote no. Because this changes it for the next 3 congressional races.
Right. This is not one of those ones where you need to complicate, you need to sit down at the kitchen table for hours figuring out who to support. This is very simple. No, that's it.
No, exactly.
No to stop Gavin Newsom, which is what this is, a power grab for him. Never mind the Democrat pride. It's purely about him positioning himself to run for president as the guy who kind of delivered the blow to Donald Trump. And he said that. He said it very clearly. And this is his quote. This is our chance to, quote, end the Trump presidency. That's how he's pitching this, which is that they take back the House thanks to Gavin Newsom's, rigged maps, and then they impeach the president, and that's it. That's how they're talking about it. So all this other BS about democracy, whatever, like, just listen to what they actually say.
It's really sad, and the state is still in a budget emergency, which Gavin Newsom declared in order to plunder the reserves, the budget reserves, the rainy day fund. We're still in that budget emergency, and yet they're recklessly spending almost $300 million to do this pointless election.
Yes, having said there's no money to implement Prop 36, which nearly 70% of voters in California approved last year to fight crime and chaos on the streets and homelessness. I mean, and
Right.
mental, whatever. Okay, talking about failure of the Democrats, there's some updates on the fire disaster in Los Angeles. Tell us what you've been reading.
Well, it's probably the biggest disaster in the history of the country by dollar amount. There were 15,000 structures destroyed and dozens of people killed. And now it happened in January. Now it's October, and the reports are coming out on what caused it or what didn't cause it. The county of Los Angeles appointed a consultant with a contract of like $1.9 million to do listening sessions because the supervisors in LA County didn't want to. They didn't want to listen to their constituents. They didn't want their staff to listen to the constituents. They hired an outside consulting firm, the McChrystal Group, in Washington, D.C. or Virginia, to listen to LA residents about the fires. But the report was scoped very narrowly, not to assign blame, not to discuss prevention or mitigation of wildfire risk, only to discuss evacuations and alarms. In other words, did people receive alerts in time to get out? That's the only thing they wanted to talk about. And so the report came out. That's what it talks about. The county has on its website, this was not intended to assign blame. Oh, really? So that's the whole point of this, is that we're just not going to say anything needed to be done differently. We're just going to march forward as if it's fine. Well, the United States Senate is not doing that. The United States Senate's Homeland Security and Governmental Affairs Committee has a subcommittee called the Permanent Investigations Committee, or the Committee on Permanent Investigations, and they are investigating what LADWP, what the fire department, what the mayor did during this catastrophe in January. They have already sent letters to the city fire department asking for records, and now on October 3rd, Senator Ron Johnson of Wisconsin, who's the chair of this subcommittee, sent a letter to the Los Angeles Department of Water and Power CEO, Janice Quinones, famous for saying she sees everything through an equity lens. That's how she's going to run the department, through an equity lens.
By the way, she's the woman that's paid $750,000 a year, right?
That's the one.
Yeah.
That's the one. And of course, the LADWP has only sent out happy talk press releases saying that nothing they did was wrong, everything was fine, this ran exactly the way it was supposed to run, and anything that didn't, it's the fault of climate change. That's what their press releases said. Well, Ron Johnson sent a letter, and he wants the records on wildfire suppression, wildfire mitigation. He wants all the correspondence and records on funding and budget issues, training, staffing, maintenance, water tenders, and backup plans. He wants the records and the communications from the governor, the fire departments, the federal agencies, the mayor, and the city council. This is all due back by the 17th of October. We'll see if they get anything.
So when can we expect their report? Is there any sense of that?
Well, I would imagine they get all the records and then they start calling witnesses. They typically have hearings and they call witnesses. I don't know that we'll get a report for a long time. It's not a fast process. But what's interesting is they have subpoena power. They have authority. They can look into all of these issues because the central problem is the mitigation of the risk. They want to say it's climate change. It's hotter and the fires are worse. But actually, that's not what has changed. What has changed is the land management, how often they clear brush, how often they do controlled burns, if they do controlled burns at all, which they've kind of cut back for air quality reasons in about 2000. New smoke management rules from CARB and all the regional air quality management districts. So it's very difficult to manage the brush. Interestingly, the city of Sierra Madre also did a report, and theirs came out in June. And they did not have a consultant from Virginia to listen to the constituents.
And
the city
just
staff,
Sierra Madre is the Eaton fire,
the Eaton
right?
fire,
Yeah.
right, in the Pasadena area. So this group, they did listening sessions, and guess what they heard? They heard people say, we have these fires regularly. This has happened 4 times in the last 50 some years. This is a recurring hazard. What is being done to mitigate the risk near the Edison facilities, in the canyon? What is being done to clear the brush? Why aren't we working with all these other agencies to mitigate the risk by land management? Because they understood, as longtime residents, what was causing it. Not climate change, land management decisions.
Exactly. And it's a very simple point of creating, well, it's so different. Well, it's the same principle. I want to sort of bring in the mega wildfires we've seen in recent years in the Sierra, in the mountains, where are huge forested areas in California, where you've had these mega wildfires burning out of control for days on end. Um, and these fires, which are right by urban areas, is the same principle, which is land management that is captured by extreme environmentalism and climate dogma. And so you haven't had, the management of vegetation and what they call the fuel load that fuels a fire. In the Sierras, it's about thinning the forests and creating fire breaks and so on. And there's a whole, if people want to read it, there's a whole report that I've done on that, and my policy organization, goldentogether.com, modern forest management. But here, it's just so obvious in terms of the LA situation, where you just want defensible space, where you've got space where there's no vegetation or trees, so that it's basically a fire break before you get to the populated areas. And the stories that you heard coming out of this afterwards, for example, flipping back to the Palisades fire, there you have this, it's a state agency, the Santa Monica Mountain Conservancy, that was actually fining them for doing the kind of work to protect their property that actually the government should have been doing. And so they were taking into their own hands as residents, saying, exactly as you say, Susan, this is what used to happen. They're not doing it, so I'll do it myself. And they were being fined. I mean, it's just outrageous.
It is outrageous, and it's this misguided environmental radicalism that does not allow for the basic civilization to survive. They do not want people to have water. They do not want people to have protection against fires. They want to protect whatever species of plant they can find in a canyon, and they want to prevent, for example, in Topanga Canyon, which affected the Palisades fire, they prevented a few years ago, they prevented old wooden power poles from being replaced with metal poles. The DWP in Los Angeles, the Department of Water and Power, was doing that, and they were stopped and they were fined, I think, more than $1 million for doing this, because there was an endangered plant called the milk vetch, somebody's milk vetch plant. And for that reason, they could not get rid of the old wooden power poles, which were a fire hazard and which were dangerous. They could not get rid of them because they couldn't do construction in the canyon. And so this is an example of insanity in California, where you can't do basic civilization maintenance and land management. They're so frightened of air quality from doing controlled burns that they enable these massive wildfires, which are also not that great for the air quality and not that great for the carbon release that they're so worried about. So the whole thing is it's just foolishness and very dangerous.
But it's interesting, the Sierra, going back to that. So are you saying that this report from the town of Sierra Madre pointed out the failures of land management?
Yes, they did. They talked about
Interesting.
all the public concerns about Eaton Canyon and how it was a natural fire hazard if it wasn't mitigated. They also talked about the evacuations and the alerts and the various technology issues that have not been kept up to date. And this brings up another point, which is that the County of Los Angeles has starved the county fire department. You might remember that in November, there was a parcel tax on the ballot for the county fire department to raise about $150 million a year. This was an initiative put on by the unions, by the firefighter unions. LA County has a $45 to $50 billion annual budget, and they can't find $150 million to replace what they said in the ballot argument was aging equipment which was affecting response times, average age 27 years on their fire equipment, on their trucks. They were starved of revenue. Why? Because the county supervisors wanted to spend it on things you would never vote for. Their preference is to starve everything where they could put it on the ballot and demand a tax increase, like police, like fire, like whatever people are really concerned about. Let it become a crisis, and then people will vote for a tax increase. Well, on the way to letting it become a crisis, it burned down these two areas, 15,000 structures.
It's a really, really deep point, that, Susan, which is that they got this sort of basic ongoing tax revenue from property tax and all the rest of it, all these different ways they're raising money. They have this massive multi-billion-dollar budget, tens of billions of dollars of budget. What do you say, 40, $50 billion, the county, the
I
budget?
believe at the time it was 45 billion, and now it's
Okay.
over 50 billion a year.
Okay, a huge amount of money. And so you've got these 5 people, the board of supervisors, in charge of that, and they are spending it, as we know, because you've said you have had separate reports on the kind of total calamity of their homelessness response and whatever. They're spending it in ways that are either uncontrolled, absolutely no, attention paid to getting results, on political priorities and ideologically driven things. But the core functions of government are neglected, but they know that their political spending wouldn't get the support of voters. And so that's just wrapped up in their ongoing budgets that no one really pays attention to. But they know that people will come out and vote for basic things like fire. So they say, okay, fine, you do that through the ballot process, adding to taxes. It's just it's a scam of it's a very deep point, that, actually. We've got to really shine a spotlight on all of this spending.
It's so dangerous. And every time you hear someone from the fire departments say, well, our technology is outdated, our communications technology is outdated, we can't connect to these cell phone networks, whatever their issue is, why is that? Why is that this has been allowed to happen when they have a $50 billion budget? What's a higher priority than fire department communications?
It's reminding me that a huge focus for me when I'm governor, as I intend to be, will be to work with, hopefully we get a good person elected as controller, state controller, because that office of state controller is incredibly powerful in going in and auditing spending at every level of government in the state of California. And we've got to expose all this, because this is the rot. I mean, this is what, again, you get from one party rule, that there's been no accountability, no transparency. And so every time you hear, and you hear all the time on local news, on the radio, whatever, and there's some issue and it's something with the schools or this or that issue, and you hear all the time the government workers or the union representatives, whatever, oh, we need more resources. We need more resources for that. Well, we need to have more. No, you've got the resources. I keep saying this fact, the budget of the state of California has doubled in the last 10 years. It's gone from 160 billion to 320 billion, more than 320 billion. They've doubled the budget. We are awash in money. We pay the highest taxes in the country, and yet these basic functions of government don't work. Everyone can see you have the worst roads in America, pretty much. All these basic things. The schools are a disaster. We've got to really focus on this spending. Interesting. Okay, Susan, thank you very much. Great to see you again.
Thank you, Steve. Great to be with you.
Joining us now, firefighter Barry Arata, to talk about the COVID madness in all its forms. Barry, great to see you. We've been talking in the real world often about all of this. I'm so happy to have you on the show today. Tell us the story here. It's so important, and I want everyone to know what we've been talking about.
Yeah, Steve, it's good to be here. The story, going back when COVID happened, I became very intrigued by how can we mitigate this problem. Nobody really knew much about it. Networked with some folks in my community, and for frame of reference, I was born and raised in San Francisco Bay Area, so living in Santa Clara County. COVID started here and other parts of California, but it hit here like February, March of 2020. And so I was very intrigued how could we keep people out of the hospital, and instead of flooding all 11 to 13 facilities here in the county, how can we kind of triage when we go on 911 calls? How can we triage people and maybe send them to one location, like a MASH style hospital? I worked with some people here, tried to get it to the board of supervisors, and we created Operation 49ers, and we were going to use the San Francisco 49ers Levi Stadium the parking lot, the facilities. It was a model that we built out, and it was immediately squashed, and shelter in place happened. So I did all this legwork behind the scenes as a citizen, not officially through my fire department, but with the connections and people I knew that were operating the emergency operations center. I was able to get this information to them. Once I saw things play out, when it was like, this is such a brilliant idea of keeping people that might have COVID, confirmed COVID very early on, out of flooding hospitals in the community, kind of quarantining people. Once I saw the politics start to play out, I started questioning everything. So it flipped me around. Fast forward, getting through COVID the first year, working, running out of personal protective equipment, no masks, no gowns. We didn't have gloves for a while. You just saw everything fall apart. We started hearing about the vaccine coming, and it was like sometime in December, we're going to offer all first responders, the COVID-19 EUA vaccine. And I thought to myself, well, I don't even know what that is or much about it. Not much research that I've read. And so when it was offered to me in December 2020, I said, hey, I'm going to let this one play out and see how this goes.
That's the emergency use authorization. That's what your EUA, that's what you mean by that, yeah?
Yes. Thanks for the clarification. So I said, I'm going to let it play out. I'm going to wait. I wasn't opposed to it, but at the same time, they couldn't tell me which one I was going to get or anything about it. There was a little bit of a target put on me for saying no while everyone was trying to fight to get down to the Santa Clara County Fairgrounds to get it. And I just said, my wife worked in pharma back in the day from an accounting perspective, and they haven't marketed this thing. We don't know much about it. So it's not something I'm interested in right now. And so very quickly, within a few months, we saw breakthrough infections happening with the vaccinated folks that I worked around, but the pressure was building to get it, not by force. People were calling and saying they didn't want to work with people that weren't going to get it because they were going to get me sick or kill their family, which is completely absurd. And then I saw the censorship machine start to really rear its head. We were told by officials in the department, our union delegates, they'll never force this. We'll never let them. It'll never happen. Boom. June, July 2021. It's like vaccinate or terminate. And anybody that was opposed to the vaccine was a right-wing nut job. You're racist, every name they could throw at you. And it was anti-vaxxer. And the pressure was real being here in the Bay Area, let alone Santa Clara County. So I saw the damage it was doing. It was dividing our workforce. It may have been somewhere around 60-40. We try to get surveys out to see where people really were. No one should have had to disclose their status because that's a HIPAA violation. So I decided, you know what? Enough. After 15 years in the department, I see all these people that are being quiet and not speaking up. So I started to speak to them, and I realized there's a lot more people that are like-minded like myself that didn't want to get it. So I led the fight, and that's where it really got weird. I did it as diplomatic as possible. I have plenty of friends and brothers and sisters in the fire service. And the second I put up a fight, it was like public enemy number one, it felt like. And I wasn't a victim of it. It was the choice I made, and somebody had to lead it. And if the officials in the city weren't going to step up and lead it, and they were all pro mandate, and the majority of your union, delegates that you elect are pro mandate, or maybe they just say, I don't want to put up a fight. It's not worth it. You're going to lose. Somebody had to step up, and that guy was me. It networked me up and down the state of California with other fire departments, the whole Firefighters for Freedom movement out of LA City. You ended up realizing it was happening in San Francisco, Oakland, San Jose, LA, San Diego, Seattle, Honolulu, FDNY, Chicago. It went everywhere. And, firefighters are really good at connecting and figuring out what's going on virtually overnight. So we had Zoom meetings, Telegram channels, the whole 9 yards, and the network just exploded. The unfortunate part was it was a pro freedom of choice movement and medical privacy, specifically here in California. And it got taken hostage as right-wing extremism, terrorist organizations, anti-vaxxers, and you got thrown into that bucket. And it was the narrative was easily flipped that you're a public servant, you're supposed to do what's best for the community. And it's like, well, the vaccine's not working.
Can I just stop you there for a second, Barry, just before and then I want to get to where this has gone and look forward. But I just want to make, because I spent a lot of time on this, and people will remember that I was very strong on this right from, I was anti-lockdown from the beginning, because I used to teach at Stanford. First couple of years we were here. Through that, I met the original heroes of all this who are speaking out against the lockdowns. John Ioannidis, professor at Stanford, Jay Bhattacharya, who became a very good friend. I was the first person to put Jay on television back in the early days of the pandemic. And the other point, and I don't want to go back into the lockdown story, but specifically on vaccines, the it's just I mean, that's why I focused on you saying EUA, emergency use authorization, going right back to that. That was a request from Pfizer and the others for the as the name suggests, authorizing emergency use of this vaccine before it had been through the normal processes, the years-long process you normally get. It's an emergency. Let's get in their own application for the emergency use authorization. There was no mention of the vaccine preventing transmission of COVID. No mention. It was purely sold, and their application was based on the reduction of severity of symptoms. That's what it was. There was nothing in there, and it was never intended to reduce transmission, to stop you getting COVID, or to stop you giving it to someone else. It was even the manufacturers never said that. And so this entire ideology around, that's what it became, a political ideology around vaccination. You have ridiculous, outrageous statements like Gavin Newsom, the governor of California, at the time, saying, if you don't take the vaccine, you're like a drunk driver. It's a despicable thing to say. And it's totally false. And I just want to make sure everyone understands that. And just to be really clear about it, Jay Bhattacharya, I went when, he came back on to talk about all of this. And he's not an anti-vaxxer. And he was, actually, literally was at lunch at our house. And I just said, look, Jay, just as a kind of professional, tell me what I should do, because I'm open. He said, look, it's very simple. If you're under 40, unless you have very severe medical conditions, there's no need to get this at all. If you're over 50, you should probably get it. If you're between 40 and 50, it kind of depends on how fit and healthy you are. If you're enormously fat, you should probably get. That was his view. A professor at Stanford. And so it just infuriates me, this whole ideology. I'm so happy to have this conversation with you, Barry, because we can't let these people forget how they lied. They lied. And I just want to ask you, did they fire you there? You said, what was it? Vaccinate. What was your line? Vaccinate.
It was vaccinate or terminate. That's how it started.
And is that what happened to you?
So no, I did not get fired, but I led the lawsuit. I did take some time away from work because what they did was they said, here's some reasonable accommodations. We're gonna look at your religious exemption or your medical exemption, which are a complete trap. That's basically saying, I agree with you, but you really don't. But I want to be exempt from this policy that you just made up overnight. And so, I led the fight across the city of over 1,000 employees. From
which city?
City of San Jose, where I've been employed for the past 19 years. And so when I led that fight, I saw the rejections of these exemptions being put in like it was a joke from the head of Office of Employee Relations in our HR system. And it was like they were mocking people, people that were on the verge of mental breakdowns because they thought they were going to lose their career over an experimental vaccine. And I want to back up my words I said a few minutes ago, that when I said that it was obvious the vaccine wasn't working, what I meant was it was supposed to stop transmission and infection. That's what it was sold to us as.
Well, again, let's just be really clear. Yes, you're right. It was sold as that by the bureaucrats. And by now you're in the Biden administration. And
Yes.
What's her name? That woman, Walensky, who was the head of the all these people. So the bureaucrats and the politicians and even like ridiculous Rachel Maddow. Do you remember a famous quote saying, if you take the vaccine, COVID stops dead. It's a dead end for the vaccine. Just total lies. And so, yes, they were lying. But I want to bring it back to the original point I made. The pharma companies never asserted it. They never said it stops transmission. It was not in their request for emergency use authorization because they never tested. They had no evidence at all on transmission. So it was the politicians and the bureaucrats that lied. Even the drug companies didn't pretend that it stopped transmission. That's the sort of foundational truth here, which is that it was never intended for that. The politicians and the bureaucrats then took it off and put out this big lie, and then people's lives were destroyed as a result of it because so many people were fired.
You just hit the nail on the head. And so we knew that if we were healthy and we stayed in shape, that we possibly could get COVID. I got COVID. I got through it before the mandate was pushed. I had it. I got through it. I looked at T-cell immunities. They were through the roof. And it made its way through, many people that way. But the vaccines, the EUA vaccines, were designed for the most vulnerable of the population. So I wasn't opposed to people getting it and saying, don't get it. It was just my personal choice was violated. And that's what the basis was the censorship, the defamation of character, the false verbiage that was put against anybody that was opposed to it, specifically here in California and the Bay Area. And then I saw friends in Los Angeles City Fire Department fired and terminated, in San Francisco the same. And they still haven't had their jobs reinstated. They're still in lawsuits. It's still in litigation. And the narrative is still the same, that you guys were wrong and you deserve to be fired. And it's we appealed to our state labor board, crickets, can't get through to them, and the International Association of Firefighters. Where are these guys? They claim they helped fight the federal cases and they can't control what happens at the state and local level. And so lives were ruined. Nurses, doctors, police officers, firefighters, the military, people in the corporate world. And I stood up for that. And I stood up for hopefully some freedom for my children and your children and the next generation. They don't have to be forced to do things. And it opened up this gigantic network, and I know you and Jay Bhattacharya are close friends. And I became friends with Jay, really affiliating myself with the subject matter experts and not just some loose cannon firefighter from the Bay Area screaming and yelling, I don't want the vaccine. I mean, I networked with the highest of the highest, and now Jay's the head of NIH. He's connected to Marty McCary. I befriended Bobby Kennedy over this and his network of folks. And there's a lot of really good people that lives were turned upside down, and they're still fighting to either get their jobs back or get back on track. So,
well, it's incredibly important. I'm 100% with you, and I'm really happy to have this conversation. It's reminding me that we must never forget this stuff. I've made a commitment that when I'm governor, we'll have a COVID accountability commission, and we're going to look into all of this, and we're going to hold people accountable for their lies and the destruction that they caused in California. And there are two parts to it. There's the lockdowns, the closure of schools, churches, businesses, and so on, all unjustified, totally unjustified. And then there's the vaccine part. And you're reminding me that we've got to do both. We've got to do both. And we will not let it drop. I will not let it drop. I mean, we're going to, and you're going to be an important part of that, Barry. Let me ask you finally, where are we now, and how does this relate to the current law in California on vaccines and exemptions and medical freedom? And just tell me what you're working on right now and where we are.
Yeah, no, that's a great way to wrap this up, Steve. So through all this, you're fighting through the legislative process, and you're realizing court cases are just getting thrown out. And it's like, go ahead and appeal. They'll make us appeal these court cases and drain our bank accounts for the next decade until some type of common sense starts getting back into the judicial system, the legislative arm. So what I've been working on, and this is, folks that you're connected to, we've been working on getting legislation pushed to, first, we'd love to amend SB 277 and 276. That forced doctors to no longer be able to give more than 4 medical exemptions in the state of California for children K through 12. It forced vaccine mandates for K through 12. And that's really where we've lost freedom of our children. And then they push that to the greater population. So if we can get those amended, because they were meant for good reasons, but those two bills had some unexpected harms, and kids can no longer go to school because they can't get medical or religious exemptions or even personal exemptions in California. And then further take it and write new legislation for medical privacy and medical freedom in the state of California. There's other states doing it. We need to do it. There's bipartisan support and power from both sides of the aisle. I've lobbied through certain groups at the state capitol on this. People are susceptible to talking about the COVID era and how, we did some things incredibly wrong. And so legislation here coming up in the beginning of the year is going to be astronomically important. Your campaign's building. We've got a lot of momentum that people are awake here in California, and they just need the facts. Get the facts out there and don't censor information anymore.
So you're saying that you're working towards introducing or having someone in the legislature introduce legislation on medical freedom at the beginning of next year?
Correct.
Even though with this 2/3 majority for Democrats in the state legislature, you think there's a shot at getting this passed?
Absolutely, there's a shot. There's going to be a lot of opposition, and I'm prepared for that. I'm not doing it alone. There's organizations and networks and individuals up and down the state. And it's a national attentions on California as well. So we need to do it, but we know what we're up against and we know who we're fighting. And we know what their agendas are. So we just need to get the message out that, I could throw this out there. There's a group called PERC, Protecting Educational Rights for Kids, that started leading this fight, 5 to 7 years ago. And they've had their hand on it as well, and people are connected to that network. So we'd love to get something put out in the beginning of the year, and pushed through, and more people to know about it.
I love it. Barry, thank you. This is going to be the first of many conversations I'm feeling, and of course we're close to each other, so we've met in the real world, and we'll continue to do that. It's great to see you here today. Tell everyone where they where they can follow your work and any other links or resources you want to point people towards.
Yeah, so my work as an individual, I'm like a supporting character. I know that the legislative fight is being led by PERC, so that's Amy Bond is the director of PERC. So PERK, PERCadvocacy.com is where you'll find press releases and current events that are going on. There's fundraising opportunities, there's speaking opportunities. So that's kind of like the tip of the iceberg, and then that opens up the organization. So if you want to get involved, you can go to the PERC site and you can sign up there. And like I said, I'm not a part of the PERC organization officially. I just am a supporting character. I've got my story from the fire service side. There's police officers, military, nurses, doctors. There's a whole network of folks. So I appreciate you getting this message out, Steve, and I look forward to doing a lot of work with you in the future.
Fantastic. Barry, great to see you. Thanks for joining us today.
Likewise. Have a good week.
So that is our show for today. Hope you enjoyed it. Make sure you follow us on Apple, Spotify, YouTube, wherever you get your podcasts. And of course, if you want to get involved in the campaign, I would love that. SteveHiltonforGovernor.com. We'll see you next week.